Sometimes some parents will come and say that my child gets very upset because he cannot make friends. They don't know their child is hyperactive.
But there were so many reported cases of heart attacks after taking vaccine. Are they true?
There has been some complications with COVID vaccine. I think it's more commonly seen in adult population.
I'm just thinking out loud. There may be so many parents in India also who might not have vaccinated their children. Do you think that they should go out there and get the COVID vaccines for their children?
I think because COVID is not going away, it is always mutating.
This is very interesting. You said there are 30% of children who might have mild to severe ADHD. Do you think that spectrum applies all across the world?
I'm pretty sure if it happens in US, I'm pretty sure it happens in India also.
It's just a general thought that I'm putting out there. There's so many Indian parents who are in denial that their children are a certain way. Guys, welcome back to Infinite Health. I'm so happy to get you the third episode with Dr. Sangeeta Agrawala, a renowned pediatrician from Texas. She works at the Texas Family Pediatric Group and has 30 years of experience. For all the parents out there, this podcast is especially for you. Please like, subscribe and share so we can bring out more good content for you. Dr. Sangeeta Agrawala, welcome to Infinite Health. It's my podcast. It's so weird calling you Dr. Sangeeta Agrawala because I've always known you as Masi. It's great that you could come here. And how do you feel today?
Well, I'm very happy to be here. I'm very happy to be part of this podcast, and especially with you, knowing you since you were born. And it's my pleasure to talk about pediatrics because that's what I specialize in.
You know, one of the reasons I joined medicine was because, I always saw you as a doctor in the family. And I always wanted to follow the trajectory that you were following. So Dr. Agarwal, what kind of patients do you see in your practice?
Well, I see all kinds of anything related to pediatric conditions. I see everything in our practice. Basically, we do a lot of checkups and routine checkups on babies from birth until age 18. We give routine immunization to all children, and we take care of common childhood illnesses. We take care of any developmental disabilities. We see a lot of autism, ADHD. We see kids with neurological disorders. We see minor injuries. We see, pretty much everything related to children, So, different seasons, we see different illnesses. Winter months, we see more flu and ear infections, asthma. In summer months, we see diarrhea, and we see a lot of skin rashes, So we see all kinds of things in our practice. And we see a lot of chronic illnesses in children also. And we also monitor them routinely about their health, how they are growing and developing. We do a lot of anticipatory guidance that what parents should expect them to do at this age. And if they are not doing, how we can help them. If, developmental history is very important in babies. So if they are not growing according to their age, then we look into different problems and, guide them accordingly. We start doing a lot of screening tests. We do hearing tests right at birth. So to decrease, the incidence of deafness in children. And if they are born with hearing deficit, then we can help them right away. And so they can develop language. So, and we start doing vision screening. We do blood pressure screening starting age 3. We do height and weight from birth until they are 18 years of age. We monitor their growth. We monitor their development. We do a lot of counseling for mental health. We see pretty much everything in our practice.
It's very comprehensive.
It's very comprehensive.
But you mentioned immunization. I wanted to touch upon that before I ask you other questions. What is the vaccination protocol like for children there?
Over there, basically, immunization is mandatory by schools. So if your child is not immunized, they cannot be admitted to school. So every child has to be immunized to go to school. So that is the law. That's a state law. And every state has a little bit of a difference in their laws, but most states require that children get immunized for most illnesses. And there are certain exceptions if they are immunocompromised or they are on certain medications, then we can delay their immunizations, or sometimes there's a religious barriers, religious barriers. So we kind of take that into consideration. We try to still counsel the parents that how important the vaccines are. And a lot of times they come around even if they have, a lot of myths they hear about vaccines. They hear on social media that it causes autism, and they say it neurologically impairs them, or but we have to do a lot of we show them a lot of actual facts and show them that it is very, very rare to have any side effects or any complications from immunization. Immunization can help build their immunity, and they help them in a long run for all their lives, basically.
I wanted to specifically touch on what you just said on immunization. Like, was there a same debate with the COVID vaccines? I mean, could children
Yes.
also take them?
Yes, of course. There was a huge debate. I mean, it was debate because it was a newer virus. It was developed in a very short time. People did not believe that, and it was a different kind of technique they used to make the COVID vaccine versus when it was not done in a normally how they prepare the vaccines. It was a messenger RNA they used. And they thought it can genetically alter humans. And, there was a lot of theories. So there was a lot of, resistance from the parents. And, but eventually, some people were, we showed them that success rate is so high, and people who got immunized did not get seriously sick, and compared to people who did not get immunized. So when people start seeing that also helped a lot in parents to come around and get their children immunized.
But there were so many reported cases of heart attacks after taking vaccine. Are they true?
So there has been some complications with COVID vaccine. And I think it's more commonly seen in adult population, and some adolescent population. They did see some cases of myocarditis or affecting the heart or increasing their heartbeat. But most of the very rare deaths, and very few cases of serious side effects. One complication happens, people get nervous. Yeah, people get nervous about it. But eventually, everybody came around pretty much. I think, the COVID vaccine, everybody pretty much got vaccinated. And, we recommended vaccination for COVID starting age 6 months of age. So I see a lot of children are immunized in the US at least. Of course, there are still, I would say 10-15% of cases, or maybe up to 20%, who don't immunize their children anyway. Even in the US, they don't believe in vaccines. They're not going to vaccinate. And so they probably didn't vaccinate COVID vaccine either, But a lot of people have, because when it first came out, because it was causing a lot of deaths, it scared a lot of people. So a lot of people did go and get immunized.
Just thinking out loud, there may be so many parents in India also who might not have vaccinated their children for COVID-19 or several other diseases that you were mentioning. Do you think that they should go out there and get the COVID vaccines done for their children?
I think because COVID is not going away. It is always mutating, and sometimes we see mild variant, and so if they did not vaccinate, their children may survive. But sometimes if the serious variant comes where it is more harmful, and it will cause more serious illness. So if your child is already immunized, then they will be upper hand, they will be protected by COVID vaccine. And we have seen, like, once most people have got COVID vaccine and they got COVID after that, the illness is usually mild. It's not very severe. Most cases, very, very seldom you can say that. And now there are other things also available. Antiviral medications are available. So it has helped quite a bit, but I still recommend everyone, all the children, to receive COVID vaccine, because actually children do better with vaccines than adults and adolescents do, because their immunity is still starting to just build up, and their body accept vaccines better than older people.
I think this is a very big message to all the young parents, the newer parents who are having kids, to vaccinate their children, because a lot of times we have short memories and we forget that the COVID pandemic happened. And like you said, it's not going anywhere. You mentioned ADHD just right now, and it's something that we've been hearing so much about. What is ADHD?
ADHD full form is Attention Deficit Hyperactivity Disorder. So it is pretty common in children. 30% of the kids may suffer from ADHD in mild to severe forms. In attention deficit hyperactivity disorder, children have problem focusing. They get easily distracted, and they are very impulsive, and they are very hyper. Sometimes they may be hyper, sometimes they may not be hyper. But it definitely does not help them in learning. So in US, basically we can diagnose very easily, and this is symptom-based diagnosis. And we give Vanderbilt forms, is called, to parents and the teachers, or whoever takes care of the children in school setting and the home setting. And if we see the similar behavior in both settings for more than 6 months of time, then we can make a diagnosis. And if it is affecting their work, some kids can have all these symptoms, but they can still learn pretty well. Then we do monitor them with just behavioral therapy. But if it's affecting them to learn in school, then and they get behind in class and they are not learning, then we do actually start them on medication. And we can start them at age 4 even, which is with the small dose of medication. But the diagnosis we make is very, we take it very seriously when we make the diagnosis. And we do make certain changes in their school, in their classroom, to make sure that, child is getting enough attention. Child is also at home. Parents also have to follow certain lifestyle for the children. They make sure that the children are not given too many things to be distracted. They get limited number of toys or limited, and their life is very structured to see if that helps them in learning. So we make changes in their lifestyle also. This is very interesting. You said there are 30% of children who might have mild to severe ADHD. Do you think that spectrum applies all across the world? I'm pretty sure if it happens in US, I'm pretty sure it happens in India also. And I can tell, like my own brother growing up, if I knew then, I think he also had ADHD, because he had problem with focusing. And when I look back, and because I always did well in school, while he always struggled in his class, and he was very smart, he was very hyperactive, but he had trouble focusing. And at that time, nobody knew this. So he did not get that help and he did not finish his school. But nowadays, this is done very well. This diagnosis is made very easily and children get help. And when some of the older children, when they are on the medication, I talk to them and I ask them what difference they see in themselves. They see that they just take the medicine and they feel more smarter now. They see no difference in themselves except they feel smarter now because they can now focus, they can learn, they have better self-confidence. So I really think, if any child is suffering from these symptoms, they should bring to their doctor's attention so they can actually work them up for if they have problems, they can help them with medication. So the medication do have side effects, but we do follow them very closely every 3 months and we talk about side effects and they do well. Actually, some of the kids will outgrow as they mature, but some kids don't mature, so they can continue to have ADHD as an adult also. So it is something which has people have recognizing more and more and getting more help. And there was a very big resistance from parents about starting them on medication. But when they see a difference in a child of their family or somebody else who are doing so well on the medication and not having much side effects, they are coming around also because they want best for their children. Nobody wants to put their child on a medication on regular basis, but something which can help them learn and do well in their life, because that's very important. Any child's life to succeed in their life. So if they cannot learn that and develop a very low self confidence because they think something wrong with them when they cannot learn. So I think it's very helpful for us to able to help them with the medication, which is going to change their life. Basically, they at least can learn to their potential once they get on their medication. And it's not, these medications are not addictive. People worry about that also. You can keep the child, we keep the child on the medication during the school days, and the days they are off from school, we do not give the medication, and they do very well.
So the first point of how a child would be diagnosed with ADHD starts with the parents, right? I mean, they have to identify certain features and then go to a doctor who can clinically judge that this is ADHD. I mean, it's just a general thought that I'm putting out there. There's so many Indian parents who are in denial that their children are a certain way. I mean, or their children might not have ADHD, or they might not even know about it. In your clinical practice, are parents also tutored when they are pregnant that these are the signs of ADHD and this is how you need to identify them?
So ADHD has gotten a lot of bad name even in US because people think, oh, we are unnecessarily putting them on medication and we are making them zombie, and we are restricting their progress. They become less active, or these medications are addictive. There is always going to be resistance. Anything we do in life, but that's not true. It's really not true. I have been treating patients of ADHD for last 30 years, and the medication has improved a lot over time. When I started practicing, the medication used to have two boosts, like, they will feel good, they will have focus for like 2 hours, then it will go down, then they will have another spike of focus, and then it will go down. And now there are medications which are evenly released for 8 hours, and the children don't feel like they are, have much side effects, and they can learn. So, and that is miracle for the parents. When they struggle in school every day, they get note from teacher, your child is so hyperactive, he's class clown, he's not, he's disturbing the class, he's not paying attention. And once they get on medication, oh, he's one of the best child now, he's excelling. So we see that difference. Then parents do understand that we are not putting them on medication just for the heck of it. We are putting them on medication because it actually helps them.
But is the reverse also true? I mean, can a smart kid have ADHD, and how difficult would it be to diagnose a smart kid?
So a smart kid definitely can have ADHD. I have seen doctors, engineers, even my husband, I think, have ADHD. And the thing is that we all can have a little bit of ADHD, and we can overcome some of the symptoms ourselves and can still perform. But if the symptoms are too more severe, then it's hard for anyone to control them. And it definitely affects their lifestyle. I mean, children not only have poor self-esteem, they also have trouble making friends because these kids are very sensitive. They are into everybody's, they try to be too close to other people, but the other kids don't like them because they are too hyper, they cannot handle them. So they kind of shy away from these kids, so they feel like they are neglected by their friends. So it is something not to be looked very lightly when your child is getting neglected in school by their friends, or the teacher is saying, oh, your child is so hyper, he's always disturbing the class, he's not focusing. You should always think that how you can help your child, and you should always consider talking to your doctor.
So, just like we spoke about vaccination, would you recommend that all parents get their children ages 4 and above getting screened for ADHD as well?
I think, as long as their children is doing well in their classroom, there's no complaints, they are making good grades, and they are easy to handle at home, uh, then I don't see it's necessary for every child to get evaluated for ADHD. But ADHD children, the parents are so tired because they are very forgetful. So they have to remind their child 10 times, you have to go brush your teeth, you have to do this, you have to do that. And they don't follow the routine. They are very hyper, they don't remember things, they are easily forgetful. So it's a big challenge for the parents to raise these kids. And sometimes they feel like, oh, maybe they don't know that all children are not like this. They think all children behave like this. They are just children, so they're going to behave like this. They need our attention. But they have to educate themselves. If they are finding something challenging, if the child is too challenging for them, they should bring that up to their
Doctors.
Yeah.
I think this is a very interesting takeaway because just like we spoke about vaccination in a similar tone, I mean, parents need to start identifying behavioral patterns in their children and then go to a doctor to get diagnosed for ADHD or not, or at least to rule out because it's based on clinical judgment, right? Or is there a strict parameter that you associate with ADHD?
So in Vanderbilt forms, there are questionnaires the parents have to fill out, like how mild, moderate, severe, how much the symptom. Based on that, we number them. So each symptoms have like a 9 questionnaires, and out of 9 questions, if parents say that their child definitely have 6 of those symptoms, then we definitely think there is a problem. And by just observing these children in your office, you will notice all this behavior also. They are running around in your office, they are never listening to you, they are very talkative. Sometimes they also are very depressed because they are sad because they are not they're neglected, or it can affect their mental health also quite a bit.
So this is very interesting because I want to understand what medicines are given for this and what happens if you don't take these medicines for a ADHD child.
So basically, if you don't give medication to your child, then of course they are going to suffer from all the symptoms. So that will kind of, some kids fail their classes. Some kids become very, it affects their mental health, like they become very upset and sad that they don't know what to do with themselves. They don't because they have low self-confidence, and some children starts acting up. They start associating themselves with the bad children in the classroom because they think they cannot do well in their, no matter how much they try, they are not going to do well anyway, so they don't even try hard at so we as a parent have to see that we have to pay attention how their child is doing in the school and what kind of behavior they are showing in the house. If parents see that, even if the teacher doesn't bring it up, and the parents see that the child mental health is not good or child is acting up, they should always bring that to their pediatrician, to find out what's wrong with their child. Like, not every child comes up with the same similar type of symptoms. Like, sometimes some parents will come and say that my child gets very upset because he cannot make friends, and so they don't know, and they don't know their child is hyperactive. They just know that he cannot make friends and he's very sad. So we have to ask, if you bring it to the doctor, then they can ask more questions, and they can help them quite a bit. So parents should always watch out for their children behavior, how they're doing in school, how they're doing at home, how they are interacting with other kids, because it's very important milestone in their life, because that's how they are going to grow up to be, to be successful or not successful. I think it's very important for every parent to make sure that they pay attention to these
to the child. Like analyzing behavioral patterns is so important because I think so many parents would be in denial of what their child is like, and they would just continue thinking that, he'll become okay after a few years or he'll change after a few years, but that might adversely impact them. But talking about behavioral patterns, I wanted to come on autism, because how is autism evolving in children these days? Because autism cases are on a rise now. And do you feel that's just to do with genetics, or do you feel there's something else?
So far, we don't know exact cause for autism. It's multifactorial, of course. So we know there may be some genetic mutations, or there might be some environmental factors, but we have not able to pinpoint any particular cause which causing autism. And it used to be like 108, 1 in 108 kids used to be diagnosed with autism. Now 1 in 35
That's a big number.
That's a big increase in number of autism cases. In the past, I'm not sure if the mild cases got recognized, because it's a spectrum. So very mild cases can easily be not recognized by parents, or if they never went to see the doctor, so they never got diagnosed. But definitely, people have to understand that it is a medical challenge right now, that some of these kids are very, very smart and very high functioning kids, but they still suffer from autism. People have to know what autism is. Basically, autism is where there's a problem with communication. They start out as a speech delay by the parents. Parents will say, "My child is not talking," and even if he's talking, it's not very consistent, and it sometimes it doesn't make sense. Like, mothers will say that my child never calls me mom. Or so it is a very challenging diagnosis. I don't think it's easy to diagnose, but something your child is not developing according to their age has to be brought up to the pediatrician attention. And we give a screening test. It's called MCHAT, which is autism screening test, and it has a multiple questions. And there are certain questions, if parents say, as their child, they say one of the question is, do you think your child is deaf? And they'll say yes. And that doesn't mean the child is actually deaf. That really means that child doesn't understand and he doesn't follow simple directions. When they ask his name, a lot of times for the children, if I say, "What's your name?" and he'll say, "What's your name?" So he doesn't understand what I'm actually asking him. And there is a problem with communication. Some children can talk and they can say a lot of words, but it doesn't make sense. And they have a lot of repetitive behavior also. And some of these kids are very hyper also. And the thing is, they also do a lot of hand flapping, and their behavior is they will play with toys, they make it in a line, they arrange them in a line, and they do a lot of things, the same things again and again and again. If the parents are noticing anything their child is not doing according to their age, then they should definitely talk to their pediatrician, and the parents have to know what your child should be doing at that age also. Parents are should know what their child should be doing, and that usually is should be told by their pediatrician. If they go for routine checkups, usually pediatrician will tell them, is your child doing this, is your child doing that? And if they're not doing it, then they definitely can help them in diagnosis of autism. And it's not a simple diagnosis, and because you have to rule out if there's any other mental health conditions, or you have to rule out everything else to make the diagnosis for autism. That if they don't have any neurological condition, like a lot of developmental delay, like cerebral encephalopathy or something like that, they have to first rule that out, because those children are also don't have some of this behavior, and they can be started on therapy, and those therapy really helps them in making a lot of progress. And those therapies are very expensive at this present time, but it is definitely worth investing on your child, because that is only way they can help their children. So far, we don't have any treatment available. There are some stem cell therapy some people are doing, saying it helps children, but it's in a very primitive stage. And so the stem cell therapy is not approved in the US, but in different countries, some doctors do it, and some people claim it's very successful for their children. I can't say much.
For sure. Now, before we end, I'd like to thank our sponsors, Decode Age. Decode Age is India's first longevity research company aiming to increase the health span of people. The supplements and tests are based on the latest scientific breakthroughs in the fields of longevity and aging sciences. The supplements they provide target the biological mechanisms that cause aging. For example, as we age, the NAD plus levels in our body decline, leading to mitochondrial dysfunction and genomic instability. Two main reasons for biological aging. And by supplementing with Decode Age's NMN, one can replenish the NAD levels in the body and tackle aging at a cellular level. Now, there are numerous clinical trials and experiments indicating that NMN increases the health span of individuals who consume it. I take it myself and it feels great. Apart from NMN, Decode Age offers other longevity supplements like spermidine, AKG, fisetin, and transresveratrol. If you want to start your healthy aging journey, then Decode Age is the place to be. Do visit decodeage.com and use my coupon code Anant to get a discount. But it's one thing to screen children, but I was talking to a geneticist and he said that there's so many young parents who are planning to have a child who can get a genetic screening done to prevent autism, to prevent the burden of autism. Is that true in any way? There is no way where you can have a genetic screening to know whether your child would be autistic or not?
No, there's no way. At
the current moment, okay.
At current time, there's nothing established as a genetic mutation which will diagnose a child with autism. So that's one thing nobody can diagnose until child is born, child grows, then only we can diagnose it. Even my own daughter, she had a baby. She got genetic testing for all these diseases, but her main concern was autism. Whether her child may have autism, because nobody wants their child to have autism.
I have another question on this. I met a fertility doctor recently, and he said that if you have children after the age of 35, the chances of you having an autistic child increases by 25 to 30%. Is there any truth to that?
One thing I have noticed, very highly educated parents who are both excelling in academics, sometimes they actually have more autism.
Oh, really?
Yes. I don't see that more with the age, and I don't know the statistics, how it works, but pretty much I have seen all kinds of families, young families, or older parents. Every family has one child with autism. Yeah. So, and people are devastated when they find out their child has autism. But some children, actually, I have seen in my practice, have done very well after therapy. I have one patient, I started following him when he was 9 years old, and I have been now he's maybe 12 or 13 years old, and I saw a significant change in his behavior, in his learning. The only thing I see that he still doesn't make a good eye contact, but he will talk. He can communicate. So there are children who improves sometime with therapy, without therapy, but it's still we have to learn a lot about it.
I think it's such great advice for young parents to start identifying behavioral patterns, especially in children, and not just for ADHD, but for autism as well. I really want to talk about gluten and lactose intolerance because there's so many parents now who are not giving gluten to their children or not giving lactose to their children. There's so many celebrity nutritionists in the country who've written that you don't need to feed milk to your child. I mean, what are your views on that? What is your view on tolerances for food?
So basically, when babies are born, their main nutrition is milk, and I don't think they can replace that time with anything but milk. Either it's a breast milk or formula, or mostly formula, because we do not recommend cow's milk at young age, because the it is not fortified with a lot of nutrition that baby might need. So the formula is prepared based on cow's milk, but they also add other nutrients so that baby has a complete meal. And at baby young age cannot eat any solid food, so their main nutrition is coming from breast milk or formula. And some babies will show signs of lactose intolerance, and which is they will have frequent watery stools, and they have smelly farts, and they will cry easily. They are irritable. Some kids also throw up a lot. Those are pretty much signs for lactose intolerance, and there is a formula which is available now, which can be fed to children, which is lactose free, so the babies do not suffer from these symptoms. And but it's very important for parents to give milk, breast milk or formula to children, because that's the only way they grow. And nowadays we recommend them to be only breastfed or formula fed up to age 6 months. After 6 months, we start them on solid food slowly. And because we recognize also that some food causes more allergies than others, so that we introduce them earlier in a very small, controlled way, so the children do not develop allergies. Like some kids have peanut allergies or other nuts allergies. We tell them to make those nuts into a powder form and start introducing them after 6 months in a very small amount, and progressively increase, and so they can develop tolerance to these allergic foods, basically. And kids do very well with them. In the past, when we found, we kind of, once the children showed reaction to certain food, we completely stopped them from giving them. And basically it does not solve the purpose of developing tolerance to these foods. So nowadays we do start them early, and it shows that they can tolerate those food if we start them in a small amount and gradually increasing the amount over time.
Can young parents do this by themselves? Can they do this, say, via protocol written for them, or do they need to go to a doctor for this? Because clearly there's no real way of diagnosing this.
So basically, we if most babies, when they are seen by their pediatrician, they take the family history. If there's a strong family history of peanut allergy or soy allergy, or fish allergy or egg allergy, then we do start introducing on children a small amount of those food, and gradually increasing the amount. We go by mostly the genetically, if the sibling has allergies or parents have allergies, then we think the child might develop allergies.
Now, this might sound very silly, but what about those fussy eaters? There's so many children who don't want to eat food. And do you feel like they might have some intolerances that the parents haven't figured out yet?
Yes, so some of the fussy eaters, especially as infants, I find them, they have gastroesophageal reflux. So because they reflux so much, they kind of develop intolerance to milk because they know they are going to throw up or they are not tolerating them. So they definitely become fussy eaters. So one of the things, if the child is not growing well and they are not taking the amount of milk they're supposed to be consuming in every meal, one of the things parents should consider that the child might be suffering from gastroesophageal reflux. And we do give medication to babies even for reflux if they're not growing well, and it helps them tremendously to grow. So that can be one reason for being fussy eater. Then certain child, if they have allergies to certain foods, they naturally don't want to eat certain foods also.
But what about children who are slightly older, say 3 years, 4 years, 5 years? Like, I mean, children are so resistant to food nowadays. They don't want to eat anything, just have a Nutella for breakfast or just have carbs.
Yeah, so that is basically some of the things are also habit, like parents are not being strict with their children. They're allowing them to eat whatever they want. And the myth about children not eating well, some of the parents don't know that up to age 1, children grow tremendously from birth. They triple their birth size. From age 1 to 4, they grow very little in the size. Like they may gain 5 pounds in a year. So their appetite is not big. And so they don't have urge to eat all the time. And if the parents are not careful in providing the nutritional food, and because child is not eating, parents think, oh, they have to feed the child no matter what. So they start feeding them all kinds of unhealthy food, and the child get used to unhealthy food because it tastes well. So of course they will like to eat that food only, and they don't eat healthy food. They have to make sure that they are, just because the child is not eating well doesn't mean that child is suffering from malnutrition. They definitely should check with their pediatrician and see the growth chart, how well the child is growing on their growth chart. If the child is growing well on their growth chart, then it should be okay, because from age 1 to 4, children do not eat full 3 meals a day. They may eat one good meal, one meal, maybe half of it, and they snack a little bit all day long. But their snacks supposed to be healthy snacks, and as long as they are growing in their growth chart, they are fine. But the parents get very worried. They don't know themselves that right now they are not in a growing phase, so they are not going to have the big appetite. They are not supposed to eat that much. And that's a frequently asked question from the parents. And then we show them how well their child is growing on their growth chart. They don't want them to make them obese, because right now how they are growing is good for them. So sometimes education helps and the parents then stop worrying about it. Some children are also genetically small because their parents are also small. So we say, if parents are small, they cannot grow to be giant, And some of them may be nutritionally deficient because they are not getting full nutrition. So they have to be evaluated by their pediatrician, and they can easily find the cause for why they are fussy and can appropriately treat it. So they should not take it lightly. They should be educated about the nutrition. They should know how much the child should be eating, what's the proper amount, and how is their child growing on their growth chart.
I think so. It's very important to actually consider your growth chart phase before complaining that my child doesn't eat anything.
Yes, because most of the time when I show them their growth chart, they are appropriately growing, but parents will say, "Oh, my child doesn't eat." Child is so small and they are not growing that much, so their requirement is very low also at that age. So they don't figure that out. They think their child should be eating like them. They can't. The child is 1/4 of their size, so they will eat 1/4 of what parents are
Of
eating.
course, because children would also grow according to the hormones, right? I mean, there's this growth spurt after puberty, and I mean,
Yeah.
is that also what affects the growth level, the growth hormones and everything?
Yeah, so in every age group, the growth pattern is a little bit different. So between 1 and 4, they definitely growth phase is very small, so they are not going to be eating a lot. But after age 5, between 5 to 9, they start eating a little bit better every year, but not to the extent they will eat more when they are prepubertal, when before their puberty hits the hormone starts to kick in, then suddenly their appetite improves and they start gaining weight also. And but that time also some parents get very worried why my child is
Eating so much.
eating so much and gaining weight. But for puberty, they do need to gain some weight. Otherwise, puberty will not happen because they need certain amount of weight for hormones to work also.
But do you think this is what leads to childhood obesity? I mean, like, do these intolerances play a part in their obesity, or is just bad eating?
I think the obesity is basically right now is an epidemic in most countries because the habits children are not playing outside, or children are not as active anymore. They sit at home and they watch TV and eat snacks the whole time, and that becomes their habit, and it's hard to change. Kids who are more active, kids who eat healthy, they are fine. They don't have any of those issues. But if your child is less active, if child eats a lot of snacks and they sit in front of TV and watch TV and eat snacks, they are going to gain weight. So lifestyle changes is very important for kids who are overweight, and we have to keep educating the parents that they should put them in some kind of sports activity so that when they come home from school, they are not sitting in front of TV and watching TV and eating snacks. And if they are active, if they are in sports, this problem will not happen.
I think it's very important because so many parents nowadays, they just focus on education, whether my child is doing well in class, but they don't focus on sports and they don't focus on physical fitness.
Yeah.
And it's so important for them to focus on the physical fitness part as well, because it impacts your mental health as well, right?
Yes, exactly. And so if they are physically fit, then they do better in school actually. Their brain blood flow is good also when they are active in sports. And sports teaches them a lot. They learn how to work as a team. They have to work with other with their partners, with their other players. So it's very important for every parent to put their child in some kind of a group sports. So that is very helpful in their later life, in building whatever career they build. They always have to work with other kids, other people, and they learn a lot of time. They learn leadership when they are playing sports, how to become a leader, how to convince other people, and how to work with other people. So I definitely recommend one sport at least every child should play.
Both for physical and mental health.
Yeah, it helps with both physical and mental health, and it also helps socially also.
Right.
They develop friendship, and that lasts lifetime for them.
So, based on this podcast, if you really had to summarize for all the young parents who are looking to, raise their children well, what would be the top 3 or 4 things that you would recommend to young parents today?
So first of all, I think it's very important for parents to do a routine checkups with their pediatrician. And if they take their time and to go see their pediatrician. The pediatrician is aware of every single time, like how much growth the child should have at this age, what kind of a height and weight that they get measured. They see their child's development. So it's very important for child parents to know he's developing according to their age. So routine well checkups are very, very important in their life, because that does help them to recognize if there is any deficiency or if there is any problems that the doctor can help them. Second thing is they must immunize their children, because in today's world, no matter, even if you immunize your child, if there is an epidemic happen of some kind, because none of the immunization cover 100% also. So it's 85 to 90%. And if you do not immunize your child, then definitely your child get very, very sick and he'll become source of infecting people. Those who are immunized also, if somehow their immunity is low, then they will also catch from this unimmunized child. So it's important. It's like one person doesn't get immunized and rest of them are immunized, then that one person can become threat to everybody else.
Yes, absolutely.
So it's important for them to keep the whole community healthy. Every parent should take the responsibility. They should not think, everybody else is immunized, and if their child is not immunized, then it's okay, but it's not okay, because that he becomes a source of infection and then starts spreading it. And thirdly, I think mental health is very important nowadays. And I think every parent should pay a lot of attention to how the child is behaving, how child is doing socially, because a lot of times, if they are not paying attention to it, becomes a big problem in their life. They do not do well in their life. That becomes the biggest problem. They might be doing okay physically, but mental health is just as important as physical health. So parents should be watching for signs of depression, signs of anxiety, signs of ADHD, signs of autism. It's an important part of child growth. So parents should definitely pay attention to their mental
Absolutely.
health.
I think young parents would love this podcast because there's so much advice and information in this that they'd really be interested to know. But Dr. Agarwal, thank you so much for coming. Next time you fly down back to India, I'm going to have you again on
you
more
again.
specific topics maybe. But thank you so much for coming.
Thank you for inviting me. I feel very honored to be in this podcast, and this is my first time, so I'm not sure how well I have done.
You've done absolutely brilliantly, because the advice that you've given, trust me, is going to go a long way, and there's going to be a lot of chatter about it, which I'm going to direct to you through WhatsApp.
I would love to hear from each and every one of them, and I don't mind criticism also, because I think we learn from what we make mistakes. So if they like it, I am very grateful. And if they don't like it, still grateful.
I'm sure they'll like it. Thank you so much.